Elizabeth, thank you for that. In the meantime, a new study claims artificial intelligence can improve predicting breast cancer risk.
Joining us now is Fox5's medical contributor, Dr. Richard Chaffoux, with more on AI and your health. Welcome. Thank you so much for coming in.
Great to be here.
Let's start with the study that came out yesterday on AI algorithms, and they say that it outperforms standard clinical risk models. So how much can we trust that?
Well, I think, time will tell, obviously, but I think the important thing for the public to understand is that AI is really just really a simulation of human intelligence. And obviously humans have input all of this data into these systems. They're not operating on their own, but for example, in certain fields, it can be very difficult to diagnose skin lesions, for example, in dermatology. They've taken groups of dermatologists to look at skin lesions, they plugged in an algorithm, and these AI systems are really very accurate at being able to detect and diagnose these lesions, which otherwise maybe people that don't see them as often in practice wouldn't be as easy to make a diagnosis. So it definitely aids and helps clinicians. The other really important thing in AI is in terms of accessing vast amounts of data. We only have so much time to access data, and now with Google Cloud, we're able to access huge amounts of data from sources that we were, as clinicians, not so easily able to identify. And we found the Mayo Clinic, for example, has partnered with Watson. And so they've actually been able to match cancer patients to clinical trials, because as you can imagine, these trials are all over the world. Some of them are relatively smaller numbers or maybe somewhat obscure, but with these built-in AI systems, it allows researchers to access this information, which can obviously profoundly impact the patient's treatment plan.
How much is this changing medicine and your business, and right for the future? Because you go to medical school, you try to study and know as much situations as you possibly can know, but you can just tap into this this technology and would probably help do your job a lot better.
Absolutely, and I think that we're seeing this already in certain fields. We're seeing this, for example, in the orthopedic field, where these radiological studies, they can become much more accurate, which aids a radiologist in terms of evaluating and creating a treatment plan, like we were saying in dermatology, evaluating moles. Is this a malignant lesion? Is this a melanoma? Is it not a melanoma? In our own field, I do a lot of hair restoration in our practice, and it's amazing. We have two systems in our practice that we've been using for years that incorporate AI. One is in the diagnosis of hair loss, and then is the actual harvesting process and site making and implantation of hair follicles. We have a robot now that in many cases can outperform how myself or my nurses can do this.
So that's what's already coming to the medical industry, the healthcare industry. That's what it's bringing right now. But it's like an assistant.
Exactly. It's like an assistant that never gets tired, never gets fatigued, never asks for time off or a coffee break. But it's important for us to remember that, we still need to make sure we're HIPAA compliant, because there could be some ethics issues about patient safety. But it's going to help to streamline workflow and also just make it more effective for us to diagnose and treat. So it's not going to really replace a physician, if you will, but it will be a wonderful extension and allow us access to gain information and to provide better care, which is really what it's all about.
So big picture here, let's talk about where the internet was 30 years ago, right? Dial up and a couple websites.
Almost, right?
We didn't totally trust the internet at that point, right?
Yes.
In the way that maybe we do now. Where are we in 10, 20, 30 years, 50 years down the road with AI and the medical field? And where are we today? How much can it be trusted? I think we kind of talked about it a little bit, but where are we now?
So where we're now, I think, Andrew, we're really at the tip of the iceberg, because we're just seeing the applications, and it's very exciting. But like in anything new, we have to be a little bit skeptical, a little jaded at first, and we have to make sure that there's our built-in controls in the end to protect patients, to make sure they get good care and to maintain ethics and privacy. But I think since we're maybe only limited by our imaginations, and who knows where we will be 20 or 30 years ago, probably much further than perhaps even somebody like Elon Musk thinks of at this point. But it's very exciting, because there are still areas in medicine that we're challenged by as physicians, one of which we just talked about was access of information. Years ago we would have to go to the library and access information. Now you can get on your smartphone and get on Google Scholar and find out information that's much more readily readily, available, just makes you a better physician. It provides more access to more information to get better care. So it won't replace a physician, but it can certainly access and augment the kind of care we can give to our patients, which is again what we're trying to do.
So provide a wealth of data to you guys as well, and also as long as there's some controls.
Yes, and knowledge is power. And this is the thing, this is what moved medicine along, has been research. And of course, the AI will help tremendously in the ability to take all of this amount of disparate information from many, many sources and actually simulate that into a treatment plan or a differential diagnosis that sometimes we may struggle with.
So much power in AI, and technology moves fast. It's amazing. It's amazing to see where we will be, and it's hard to look at the crystal ball. But thank you so much for the insight, Dr. Zeffo. Always appreciate the insight. All right, we'll be right back here in the Fox 5 News at 1.
You're watching the Fox 5 News at 1.